In Ascend, we looked at two comparisons of treatments, one related to omega-3 fatty acids and one related to aspirin. So thinking about the omega-3 fatty acid part, there's been for several decades a lot of interest in the relationship between fish oils, omega-3 fatty acids, and the possible prevention of heart disease. Epidemiologists have shown us very clear associations, and so early trials in the 1980s and 1990s showed promise, suggestions that perhaps omega-3 fatty acid supplementation may well have a role in the prevention of cardiovascular disease. So in Ascend, we wanted to explore that a little further. Now, Ascend was designed back in 2003, and so a number of studies have come along since then, which unfortunately have tended to show disappointing results and not confirmed the benefits that were seen in those earlier trials. But Ascend is one of the largest, well, it is currently the largest and longest placebo-controlled trial. So we felt this had really the opportunity to get very robust and reliable answers to this question. Ascend had 15,500 people with diabetes. It was conducted entirely in the UK. They had diabetes at baseline but no prior cardiovascular disease, and all over the age of 40. The study design is quite interesting. Alongside the science, it's a rather novel approach to conducting clinical trials done entirely by mail. So we sent questionnaires to study participants asking them to tell us about major medical problems, and we sent the study treatments in the post to them. So it's quite novel in that respect, and it helps us to keep costs down and allow us to run what is a very important clinical trial at a fraction of the cost of most such studies. So when we looked at the data at the end of 7.4 years of follow-up, we found, somewhat disappointingly, that the primary endpoint of serious vascular events, that's myocardial infarction, ischemic stroke or transient ischemic attack, or vascular death, excluding hemorrhagic strokes, that occurred at a rather similar rate in those allocated the placebo compared with those allocated the active omega-3 fatty acids. Disappointing, but in line with recent studies, as I mentioned earlier. And I think really it confirms for us that this dose of omega-3 fatty acids, the 1 gram dose, doesn't seem to have a clear role in the prevention of cardiovascular disease. So based on the earlier studies, some guidelines do advocate this low dose of omega-3 fatty acids for prevention of cardiovascular disease, particularly in secondary prevention. And guidelines recommend increased fish in the diet for primary prevention. But I think really this study casts some doubt on the recommendations for supplementation. And I think there is little justification for recommending this dose when one looks at this trial and the accumulating evidence over the last few years from other populations with no real clear benefit emerging with the use of supplements. So I think the outstanding question remains the dose. We chose the 1 gram dose because that was what had been shown to be potentially beneficial in the earlier studies, and it's the dose that was being recommended in guidelines. But we know that that dose, that rather low dose, doesn't have clear effects on lipids, in particular triglyceride levels. Whereas as you go to the higher doses, 2 to 4 grams daily, then you do start to see effects on triglycerides, and indeed those higher doses are recommended in clinical practice for reducing triglycerides in people who have particularly high levels. So I think the question remains as to whether the higher doses might have a role in the prevention of cardiovascular disease. And there are a couple of other studies that are ongoing that hopefully will provide important data on that and help to answer that outstanding question for us.